In a significant escalation of its restrictions on Gaza, Israel has announced it will suspend more than 36 humanitarian organizations, including the globally recognized Doctors Without Borders, (MSF), over alleged non-compliance with new rules. The decision has sparked immediate condemnation from international aid groups, with many warning that this move will have catastrophic consequences for the people of Gaza, who are already enduring severe hardships due to the ongoing conflict. Israel's suspension affects a range of aid organizations that have been providing essential services in Gaza, where the healthcare infrastructure has been decimated and basic needs are at critical levels. MSF, one of the largest medical aid groups operating in Gaza, is one of the major organizations caught in the ban. MSF supports around 20% of hospital beds in the region and is involved in 1/3 of all births, playing a vital role in the survival of civilians. The Israeli government claims the organizations failed to meet new regulations designed to ensure that humanitarian aid does not inadvertently support armed groups. However, MSF has strongly denied these allegations, stating that its work is entirely focused on providing impartial medical care and humanitarian relief. The group has expressed its deep concern over the impact of the suspension, particularly given the severe toll the conflict has already taken on Gaza's health system. The ongoing war in Gaza, which began in October 2023, has already caused devastating loss of life and infrastructure. According to the latest figures, at least 71,266 Palestinians have been killed, and more than 171,000 have been injured in the fighting. On the Israeli side, 1,139 people were killed during the October 7 attacks, and around 200 were taken captive. In Gaza, where much of the healthcare infrastructure has been destroyed and thousands of people are in desperate need of medical attention, the suspension of aid groups like MSF is seen as a deadly blow. Medical facilities are overwhelmed, and the region faces shortages of essential medicines, surgical supplies, and staff. The situation is especially dire for women and children, who are disproportionately affected by the lack of medical care. The international community has expressed alarm over Israel's decision to suspend humanitarian organizations. Dr. James Smith, a British physician who has worked in Gaza, called the restrictions ruthless and warned that they would exacerbate an already horrific crisis. Dr. Smith, who himself was denied re-entry by Israeli authorities, emphasized that the move would have catastrophic consequences for both the civilian population and the healthcare workers trying to provide aid. International aid organizations, human rights groups, and the United Nations have all condemned Israel's decision. They warn that cutting off humanitarian assistance will only worsen the suffering of Gaza's civilians and could lead to further violations of international humanitarian law, which protects the rights of civilians during armed conflict. Some experts have called for urgent international action to ensure that humanitarian aid can continue to reach those in need, even if it means bypassing the new Israeli regulations. Israel has justified its decision on the grounds of national security, claiming that some humanitarian organizations have links to groups that support terrorism. The Israeli government argues that such links pose a threat to its security and that these organizations must comply with new regulations to ensure that aid does not fall into the wrong hands. However, many of the organizations affected by the suspension, including MSF, have strongly denied any such affiliations. They maintain that their work is strictly humanitarian and that they adhere to the highest standards of neutrality and impartiality. As Gaza's humanitarian situation continues to deteriorate, the suspension of aid groups is likely to compound an already catastrophic crisis. Without access to essential medical supplies and aid workers, the civilian population in Gaza faces an increasingly bleak future. With the health sector in ruins and a lack of basic services, many fear that the suspension will lead to even higher mortality rates and more suffering. Humanitarian organizations are calling for the immediate reversal of the ban and for an independent investigation into Israel's claims against these groups. However, as the conflict shows no signs of easing, the coming weeks will be critical in determining whether international pressure can change Israel's stance or whether the blockade on aid will persist, deepening the suffering of Gaza's civilians.